And great, and I'll introduce our speaker. So Emma Gomes is an exercise oncology specialist and founder of Project RX, a functional fitness program designed to support cancer patients and survivors through evidence-based movement. She holds a doctorate in human bioenergetics with a specialization in exercise oncology from Colorado State University, where her research focused on the impact of acute bouts of exercise on cancer-related fatigue. Her work centers on making exercise a practical and accessible part of cancer care. So I'm really excited to have Emma jump in. We'll hold questions until the end. So we'll have plenty of time at the end to answer any questions you have that come up. And with that, I'll hand it over to Emma.
Awesome. Thank you so much, Christine. Welcome, everyone. Thank you so much for kind of joining us today and tuning into the webinar. I'm super excited to be here with all of you and kind of share some more information. Like Christine said, our kind of webinar or talk today will really be focused on exercise and moving more for cancer and ultimately really finding a routine that fits all of your lives. So maybe you're all here because you're curious how to start exercising during cancer diagnosis, or you've heard benefits or what to do, but you're not sure how to tackle that or how to start. So hopefully today we'll kind of give you some more insights on how to do that. Um, Make sure I can, there we go. Oops, excuse me. A little bit more about myself. So as Christine said, my name is Emma Gomes. I am the founder of Project RX, a functional fitness company designed for cancer patients and survivors to get them moving and strength training. I have a PhD in exercise oncology. So I've spent all of my research years kind of working on and focusing how we utilize exercise to really combat side effects and tackle some of those symptoms before, during, and after cancer treatment. I'm a certified cancer trainer, exercise physiologist by trade, and then also a CrossFit coach and kind of the basis of what I do. Perfect. So a couple kind of big takeaways or main focuses for our talk today that we're going to kind of go over just so you can all kind of see our pathway or our plan. We're going to go over some common exercise myths and see kind of what's out there, kind of talk about a couple of them. We're then going to talk about what really exercise is. We're going to kind of break down what are the types, what is in exercise intensity, and kind of what those categories are. We're also going to talk about some research-based evidence guidelines that have been put out for cancer survivors specifically. Then we're going to talk about some exercise and side effects and how exercise can be an extremely beneficial way to combat side effects. And then the whole second part of our talk is really going to be tackling common barriers of exercise. We'll go over three main barriers and really how to adjust or be flexible within those barriers to help us get moving more every day. And then finally, we're really going to talk about a plan. So hopefully you all leave here today with some action items or some steps moving forward to how we can move some exercise into each and all of your days. So first and foremost, we're going to talk about some myths versus facts. So I'm sure the couple that we're going to go over, a lot of you maybe have heard through any kind of health things, social media, different things. So we want to kind of talk about a few here. One of them is rest is always best. So kind of medicine a while ago, kind of the thought was a diagnosis of cancer means we can't maybe do much. We got to really recover and rest. And of course, there's a time and place for that. But when we're thinking about recovering from cancer treatment, getting movement is really medicine in this sense. So movement helps improve anxiety, depression, fatigue, and really increase overall quality of life during a cancer diagnosis. So sometimes rest isn't always best in certain situations. Again, everyone going through different things, but we really want to talk about getting moving as much as we can, really to get those benefits of exercise. The second one is maybe you've heard exercise needs intense workouts. Maybe you've seen, people running marathons or different things. They're like, I have to do that to be able to exercise. Actually, that's not true. Light intensity exercise or just general movement is also super important. There's a place for everything, but we don't have to do super intense exercise to be able to get any kind of benefit out of that movement. And that third one is I need a perfect plan to start. So I know a lot of us maybe make New Year's resolutions or like, okay, we'll start on Monday, we'll start at the beginning of the month. We kind of wait for this perfect scenario to get moving or a certain equipment. But we're going to really talk about today that consistency over perfection is really the key to being movement and being active during a cancer diagnosis and beyond. So we're going to talk about, again, how to be flexible in that schedule and to really integrate it into our daily lives. So the first thing we're going to do is break down two types of movement. So you may have heard these two terms used interchangeably. Some are used in different contexts. We're just going to separate them for this slide just so you can understand the difference. But as we move forward, we'll consider them same thing. So we'll go over one is the term physical activity. And the second one we're going to talk about is exercise. So, physical activity is any bodily movement produced by skeletal muscle that results in energy expenditure above resting levels. So, we think of physical activity, we think about any activity. Maybe you commute to work via bike, or you walk, or you do gardening, or housework. So, maybe you vacuum, all of that energy expenditure. We're still burning calories and working out, but we're more of that integrated physical activity. So, movement during our day where exercise is more planned, structured, and repetitive. So it's performed to improve or maintain physical function, health, and fitness. So the difference is if, say, we bike to work, which is awesome, there and back, but then we plan at 4 p.m. we're going to go to the gym and exercise for an hour. So we have a plan. We're really targeting those big health benefits as we move throughout our day. So we're going to talk about physical activity and exercise and use them both in today's context. Okay, so now we're going to talk about exercise types. So, really, what kind of exercise should we be doing? First, get the next slide. We're going to talk about aerobic exercise or cardio exercise. So, maybe you heard we're going to go do some cardio. This is the type of exercise we're talking about for today. So, this is type one. The definition is that any aerobic exercise is dynamic activities that involve large muscle groups and result in substantial increases in that heart rate and energy expenditure. So when I want you to think about aerobic exercise, I want you to think about any kind of exercise that's going to get your heart rate up. Maybe you're breathing a little heavier, you're sweating a little bit, kind of that aerobic exercise. And there's a ton of benefits. So regular, moderate to vigorous intensity exercise has shown there's positive effects overall aerobic fitness in our blood pressure, cholesterol, and metabolic health. So that really overall cardiovascular health is really improved through this aerobic exercise. A few examples of aerobic exercise would be one, brisk walking, running, biking, dancing, hiking. So again, any of these activities that really involve this large muscle group, we're getting our heart rate up, breathe in. So this is one type of exercise we are going to talk about today is aerobic exercise. Number two, or the second one, is resistance training. So sometimes can be called strength training. Sometimes people call it resistance training. Those are one and the same. The definition of resistance training is an exercise that causes the muscle to contract against an external force. So something that we're using force against our muscles to build those muscles back up. So a ton of benefits in resistance training. Improvements in muscular strength, endurance, lean body mass, bone density, which we'll get into a little bit later, but really anything that helps us build back up that muscle. So activities of that, we think about body weight movement. So any kind of movement like a push-up, an air squat, a lunge, those are resistance training movements. Anytime we use a barbell or dumbbell, you think about kind of lifting at the gym, maybe we're doing curls or presses overhead, those are resistance workouts because we're using that weight to that external force. The third example is machines. So maybe you've been at a local gym or kind of rec center. We've seen those leg or chest machines. Those are considered resistance training, as well as resistance bands. So maybe you have bands that have handles you can put around the door that we're using against our body weight. Those are also resistance training. So now we're going to go ahead and talk about exercise intensity. So we went over our types with aerobic and resistance, but now what is exercise intensity and how do we kind of moderate that? So how hard are we working during the sessions? I'm going to talk about two ways today that we can measure exercise intensity. These are more subjective, so these aren't the only two ways, but it's a way that we can use at home without having to have any special equipment or any fancy technology. These are ways we can monitor our exercise intensity without using any external equipment. So the first one we're going to talk about is RPE, or rate of perceived exertion. So I know this trade was a little bit to look at first. What I first want us to take our attention to is on the left side, we have the RPE scale. So 1 all the way up to 10. So this RPE scale allows us to self-perceive how hard we're working during an exercise session. So for example, how we potentially would use this scale is a 1 on the scale is probably a lot of us currently right now. It's very light activity. We're sitting down in a chair. Maybe we're not really exerting a lot of energy, that kind of thing. We're watching TV. That would be rated an activity of an RPE of 1. Then you have an RPE of 10, so this max effort energy or activity. So you want to think about maybe you sprint 100 yards and you're going complete max effort. That could be rated as an RPE of 10. But when we're using them in everyday activity, maybe we're on a walk or we're lifting weights, We can utilize this chart to kind of see if we're working at light intensity, moderate intensity, or vigorous or hard intensity. So as you can see, that 1 through 3 on the scale, so if it feels like you can maintain for a long time, easy breath, that would be light activity. So maybe you're on a walk, and you can kind of have a conversation on that walk. That could be light intensity. Anything between a 4 to a 6 on that scale is moderate. So we're breathing a little bit heavier now. We're not having as much of a conversation. That could be considered any kind of moderate intensity. And then 7 to 10 is that vigorous intensity. So we can kind of use this to gauge what we're working at during a workout. Now, the second way is very similar, but it's called a talk test. So another subjective way that we can all self-monitor how hard we're working during an exercise session. So as you can see on the table on the left, there's 3 different colors. We have 4 different categories here. So not difficult exercise or light exercise, moderate exercise, vigorous exercise, and extremely vigorous exercise. So how we use the talk test to measure our exercise intensity is kind of what it sounds. So we gauge our ability to have a conversation with someone or just in general to yourself, and that's how we gauge intensity. So in that green bar on top, if we can speak very clearly, we can have full sentences, we don't have to pause, like take a breath and talk. That means you're probably doing light intensity. So you can be anywhere you want and kind of gauge that. Moderate intensity, you can still speak kind of easily, but you might need to take a little bit more of a breath. And you might not be able to sing. So maybe you're a singer and you can't sing a full song. Maybe that is moderate intensity. Or then we have vigorous or extremely vigorous exercise. So this, say you're you're doing that 100-meter sprint, right? You're probably not having a conversation with the person next to you. That's kind of how you can gauge if you're doing vigorous intensity or not during that session. So these are just both tools to kind of add to your toolbox to help gauge how hard you're working during an exercise session. Okay, now we're going to go ahead and move into some general exercise guidelines for cancer survivors. So, research has guidelines based on randomized control trials. So, numerous trials or clinical trials have been conducted on different exercise sessions with aerobic resistance, different exercise intensity types to kind of find how much and what kind of exercise is beneficial for cancer survivors and patients to do generally on a week-to-week basis. So, what I mean by that, the first thing they found is overall general goal is to avoid inactivity. So within our day or our week, we really want to try to reduce overall sedentary time to get the most benefits. So that's number 1, is that avoid inactivity. The number 2 is to aim for 150 minutes per week of moderate intensity exercise. So kind of that general or central part on that RP or TARP test that we talked about, or 75 minutes a week of that vigorous. So that kind of high heart rate, maybe you aren't speaking a lot, that type of exercise. So that's aerobic. And we're thinking walking, running, that kind of exercise. Then the third recommendation from these guidelines is 2 times per week of resistance training. So that dumbbell, those body weight push-ups, those kinds of things. The goal is 2 times per week of that. And it's on non-consecutive days. So what I mean by that, the guideline for the week is, say you did a resistance training on Monday, you want to take Tuesday off to be able to do resistance training on Wednesday again for your body to recover. So these 3 things are the main kind of general takeaways that research has provided to have the maximum health benefits for cancer patients and survivors at this current time. And we'll kind of jump into a little bit of these in a little bit, but those are our general guidelines. Okay, now we're going to hop into cancer-related side effects. So exercise helps improve both physical and mental side effects of cancer treatment. There is a handful of different side effects that exercise can benefit. We're going to kind of focus on 3 today just for the sake of this presentation, but this is not an all-inclusive list that we'll talk about. The number 1 is cancer-related fatigue. So a lot of us maybe on this webinar have experienced that kind of exhaustion or tiredness that isn't alleviated by sleep. We feel it mentally, physically, cognitively. This is general tiredness. So movement and exercise has proved to actually be one of the best ways we reduce or decrease this cancer-related fatigue. But I hear you're telling me, you hear me telling you, well, you're already tired. So to decrease that tiredness, you have to expend more energy to exercise, right? To be able to decrease that fatigue. So I know it kind of sounds like a paradox when I say it, but the whole idea is research has proved that maybe we don't feel great or we feel really tired. And if we can just exercise for a little bit, we may be able to decrease that fatigue after a session and feel actually a lot better, higher energy, lower fatigue, after a bout of exercise. The second one is that anxiety and depression. So movement can help reduce stress and feel more in control during uncertain times. So exercise has been shown to be extremely beneficial in reducing anxiety and depression symptoms. The third thing we're going to focus on is physical function. So exercise and movement makes everyday activities feel easier. So again, we help build that muscle mass, that bone density, that independence factor that exercise gives back really can help benefit that physical function. Okay. Now I'm going to show you another research-based kind of tool here, this chart and table. This is the effects of exercise on health-related outcomes in those with cancer. So we're first going to look at the top of the table. In that green bar, we have our cancer-related side effect or health outcome. We have aerobic only, resistance only, and a combination. So how we would look at this table is all of the health-related outcomes that are under the purple tab currently have strong evidence or research evidence that show that exercise is beneficial in reducing or benefiting these certain health-related outcomes. The two in blue show that there's moderate evidence. So we have some, but not a ton of evidence currently. And I want to draw your attention first to this first red box where it talks about cancer-related fatigue. So as you kind of go across the box to the right, as you can see in the first column, aerobic only. So if we exercise for 3 times a week for 30 minutes per session of moderate intensity, that has shown to help decrease fatigue. Then resistance, again, that twice a week for 2 sets of 2 to 15 reps of major muscle groups working at a moderate intensity has shown to improve cancer-related fatigue. Or that combination means you're exercising both with aerobic and resistance movements for 3 times a week for 30 minutes per session, plus that 2 times a week of resistance training. So that combo of the aerobic and resistance is also extremely beneficial when reducing cancer-related fatigue. Now we're gonna draw your attention to that anxiety and depression. So it's very similar idea. So currently we have strong evidence for aerobic. So it shows that 3 times a week for 30 to 60 minutes is actually extremely beneficial for anxiety and depression. We have a little bit less evidence or insufficient evidence currently on resistance, but it does recommend in that combination to do sets of both. So we kind of have strong evidence for all of those health-related outcomes. And the last one I'm going to kind of point your attention to on this table is bone health, which we'll talk about in a little bit. But we know that there is strong evidence that resistance training is extremely beneficial for that bone health during and after cancer treatment for today. Okay, so we're going to jump into muscle mass. So muscle mass is like a huge important factor, kind of the main thing a lot of people are talking about now in the exercise world and looking at that in oncology. So first, muscle is really the key to independence. If we lose our muscle mass, we're not able to do a lot of activities that we normally do. Muscle mass is a huge indicator and helps our body tolerate treatment. So the more muscle mass we can go into treatment with is more beneficial in that recovery or ability to have our full amount of treatment. The third one is muscle helps support recovery. So after treatment or after a surgery, having more muscle mass can be extremely beneficial and it really improves that daily function. So again, activity, daily living, getting out of bed, doing chores, different things like that. We really need that muscle mass to be able to do those activities. Because as you can see in that picture on the left, we have that normal bone, and that muscle tissue. Really, it's kind of condensed and all the way out to the outer layer from that bone inside versus that sarcopenium bone and muscle on the right side is kind of in that deficit, right? We don't have as much muscle mass in that example. Okay. The next thing we're going to talk about is bone density. So exercises are really beneficial when changes in bone density are maximized with activities that increase bone mechanical strain. And what that means is we have to do exercises that kind of strain the bone to be able to rebuild it and kind of gain that external force. So examples of this would be any activity such as high impact weight bearing exercises, so jumping, muscular strength activities, those kind of things are the exercises that really benefit bone density. In comparison, so say longer walks, maybe the elliptical are beneficial for that aerobic or cardiovascular health, but they aren't as beneficial when we're looking at bone density specifically. So we really want to pick movements, squats, lunges, things that kind of give strain on that bone to be able to make it grow stronger. So you can see on the left here, 2 pictures. We have that healthy bone on the top, then we have that osteoporosis bone on the bottom. So you can really see the difference of that bone structure when we have lower bone density versus that healthy bone density. Okay. Now we're going to talk about activities of daily living. So these are activities that are foundational skills needed to manage one's basic physical needs and are required for independent living. So a couple of those activities that we think of when we think about activities of daily living are on these top pictures. So using the restroom, so getting up and down from the bathroom, picking anything up off the ground, kind of combating falls. So any kind of falls that happen in our home or outside. And then also just things like carrying our groceries or shopping bags or anything that we have that kind of grip strength that we need. So these are considered activities of daily living. So you might think about, why am I showing you those? Well, exercise can be extremely beneficial in improving our ability to independently do these activities. And what I mean by that is, first, is using the restroom or getting up really requires a lot of leg strength, right? So squats, any kind, sit stands, air squats, any kind of weighted squats are going to help us build the muscle mass and kind of muscle memory to be able to perform activities such as getting out of bed or getting off the, going to the restroom and those kinds of things. Second is anytime pick off the ground is actually really a deadlift, right? So if you use a bar to pick up the ground, a lot of us don't know how to properly and safely pick items up off the ground without hurting our back or tweaking it and that kind of thing. So these deadlifts are extremely important. A, teaching us how to move properly and pick things up, but B, helping us build that posterior or the hamstring strength to be able to pick up items safely. The third one we'll talk about is fall. So if we've ever fallen in our daily lives, we have to get back up, right? That's the whole point, is we have to have the ability and the muscle capacity to stand back up from that fall. So one activity you want to think about movement wise is a burpee. So practicing, again, getting back on the ground and standing up and having that strength to do that independently. And fourth here, carrying our groceries kind of relates to that farmer's carry. So if you ever like any kind of dumbbell or weight that we're holding, it's extremely beneficial for our grip strength. So grip strength has been proven to be extremely kind of beneficial and factor into that independent living. And then also just carrying a load on both sides of our body. So having the strength to evenly carry loads is extremely important. So we think about adding activities in like this, so functional movements that allow us to build up that strength to do daily living activities. All right, now we're going to go ahead and talk about different exercise priorities. So, exercise may look different depending on where you are in the cancer continuum. And what I mean by that is we're going to talk about each one. So, we'll talk about pre treatment or surgery. So, before you have any treatment or surgeries. Then, we're going to talk about exercise during treatment and then post treatment. So, we're going to break down, for the purpose of this, exercise main goals and different considerations into three of these categories. So, the first one, we're going to talk about pre surgery or treatment first. So when we're thinking about maybe potentially being in this stage, we were just received a diagnosis or waiting to start surgery or treatment, here are some main goals when we think about how to look or attack exercise during this time. First goal is to build strength in an endurance base. We want to be as healthy and have as much muscle mass as we can before we enter that surgery or treatment stages for that better treatment tolerance or that recovery. The second is maintain mobility and range of motion. So, for example, if we have any kind of breast cancer surgery, we may lose range of motion due to lymph nodes and overhead mobility. So, having that full range of motion movement or even practice with those movements before surgery or treatment is hugely impactful for that post recovery. And third is start slow and progress. So we always want to see what our body is tolerating. And again, these are all dependent on your own kind of area. If you're allowed to exercise or different things, it will be individual based. But if we are looking to move, it's always good to start slow, see how your body tolerates different movements, and then progress exercise as tolerable. All right, now some main considerations when we're thinking about pre-surgery or treatment. First is our current fitness level. Have we always been active? Have we been a runner, or maybe we lifted weights prior to a cancer diagnosis? That fitness or what we're doing exercise wise before we start treatment could look a little bit different unless in comparison if someone is inactive and then they just got a cancer diagnosis and now we're kind of starting from a little bit of a lower fitness standard. Both super important, both benefit from pre-surgery and treatment exercise. However, it might just look about a little bit different on that intensity or duration time point. The second consideration is time frame before surgery. So do you have a week before surgery or treatment? Do you have a month? What is your timetable? That might depend on what kind of exercise you're able to do during that time. And third here is consistent movement is better than exercise intensity, or kind of framing it as getting more movement in as much as we can is more important during this time point than kind of focus on what exercise intensity I'm working at. So any kind of movement is important during this time, rather than like, okay, if I'm not doing high intensity, that's okay. Movement more here is better. Okay, now we're going to go ahead and switch gears to during treatment. So exercise during treatment. Our main goals here is number one is maintaining physical function. So maybe we're not hitting huge PRs in the gym during treatment, and that's completely okay. But the goal is to hopefully maintain that physical function, that muscle mass, that bone density that we started treatment with. So hopefully not kind of stopping a lot of loss from happening. The second thing is managing symptoms. So everyone has a different treatment path, and everyone might be experiencing different symptoms or side effects during treatment. So the first and foremost of exercise wise, we have to manage those symptoms and make sure it's healthy enough and safe for us to exercise during this time. And the third main goal is movement breaks. So we want to think about we sometimes during treatment we may not have full energy to do an hour of workout, and that's completely okay. Maybe we break up our session into 15-minute segments, or we take more rest during the session. It might look different for everyone, but the goal is to kind of give yourself some grace during that time and allow movement breaks to use to your advantage and kind of utilize that during your training. Okay, some considerations. We a little touched on this a little bit, but the first one is side effects. So if we're experiencing fatigue, nausea, pain, I know sometimes research has shown that fatigue can be a little bit less in the morning and it really spikes in that early afternoon. So maybe we're trying to exercise early in the morning to get it out of the way and feel the benefits to the rest of the day rather than waiting till 2 to 3 p.m. to do exercise. Same thing with maybe that nausea or pain, maybe exercising around certain times when we feel a little bit better. So kind of setting ourselves up for success there. The second one is treatment schedule. So for example, if we're on kind of cycles of chemo, maybe we know, okay, I'm feeling good today, but I know in 3 days that I will not be feeling great and I'll maybe be resting in bed. So when can we put our exercise into our treatment schedule that we're able to move a little bit to give ourselves grace on the days that we may not be able to have to rest and recover on those days? And third is intensity may look different day to day. So I'm sure a lot of you have experienced maybe one day on Monday you feel awesome and you feel high energy, and then Tuesday you don't. You feel kind of tired and worn down. That's completely okay. We're expected to feel differently day to day. So therefore, we just have to alter different intensities based on how we're feeling that day. And this is a huge point we'll talk about in the second half of our presentation. But I kind of a main point that I want to think is it doesn't have to look the same exercise wise every single day for us. It can look different. All right. And third here is that post-treatment. So maybe we finished up chemo radiation or we had surgery and we're kind of in that post-treatment stage. A couple different main goals here. The first one is our goal is to rebuild that strength and stamina. So now maybe we're a little bit farther out from treatment. We're back in the gym a little bit more. Maybe we're in a routine. So maybe we're looking at increasing the weight or increasing the duration of exercise, those kind of things to rebuild any of that strength or stamina. The second one is independence and activities of daily living. So we keep going back to the activity of daily living, but they're super important, right? We want to figure out how do we get back to our everyday activity we did. Maybe we're going back to work or different things we want to do, play with our grandchildren. Again, we have to kind of focus on what's important to us now that we're post treatment, and what do we kind of want to work towards or build that strength. What's important to us. And that third, it kind of flows into that is exercise confidence. So a lot of us will have to kind of adapt to that potential new normal after treatment. So what that looks like for us and kind of giving ourselves grace. Maybe we weren't an exerciser pre-cancer and that's completely okay. And now we're looking to add movement into our kind of routine and giving ourselves grace when we do that. And our considerations is one is that gradual progression in duration and intensity. So first off, we just want to try to get moving. We don't really care how long and what intensity at first. Well, that'll come afterwards. But once we get comfortable and our body can tolerate certain movements, then we work on increasing that duration or minutes of exercise we get, increasing that intensity, and everything will come with it. The second consideration is that ongoing side effect. As all of you know, side effects do not end the minute you walk out of treatment, right? Some linger for a while, months to years after treatment, and really finding a way to exercise around that or mitigate those side effects using exercise is really important here. And third is building a new routine. Again, you might have less appointments now and different things you have to be at. So how do we build a new routine that exercise fits into for you post-treatment? Okay, so a quick little recap before we move into our second part of the presentation. So far, we've kind of talked about really what even is exercise, what are the types, how do we maintain an exercise intensity and those things. We talked about the research-based guidelines, that 150 minutes a week of aerobic exercise and that 2 times a week of resistance. We talked about treatment and side effects and how kind of exercise plays a role in all of those. And then we talked to kind of broke down exercising across the continuum. So that was kind of the big information piece. And now when we flip to kind of the second part of our presentation today, we're really going to figure out and kind of talk about, we're going to break it down. So we have all this information now. So how do we really put it into use? So first, the biggest challenge isn't always motivation, it's real life. So some of you on this call, maybe you kind of see this counter like, yeah, that's what my week looks like, right? I have a million things to do, a lot of responsibilities. So sometimes we know exercise is beneficial, but it's really about how we fit it into our day-to-day routine. So why motivation may not be the problem. So in exercise oncology currently, we have this knowing or this knowledge. So maybe you know that exercise is beneficial. You've heard, you've read a paper, you've seen it on the internet. Maybe your oncologist is like, you should start exercising. So you know, right? You know, could be beneficial. However, doing and knowing are sometimes two different things. So we know that exercise is beneficial, but how do we actually implement? How does the doing part come into part? And this is that gap. So this is what we're going to kind of talk about today is how do we take this knowledge of exercise beneficial and move it more into the doing stage that I'm an exerciser and I'm implementing this into my life. Okay. So again, the challenge of exercising isn't always information, it's implementation. So as we kind of look at the right here of this workout log, kind of thinking about breaking down our days of the week into exercise, and that's kind of what we're going to talk about next, is how do we implement exercise and really take it into our daily routine. So implementation. So your day-to-day life can constantly change, especially after cancer diagnosis, right? Your energy different days, fatigue, different side effects, different appointments that you're kind of juggling all at once. So the challenge isn't always knowing what to do. It's figuring out how to actually do it in a way that works for you. And again, we're all individuals. We have all different schedules. We have all different side effects we're experiencing. So sometimes this exercise program really has to be customized or personalized to what works for you. We always say the best exercise that cancer survivor can do is exercise that they actually do, right? So you maybe you've been told, okay, go start running or jogging. You're like, I actually don't like running at all. You're probably not going to enjoy it or do it much, right? But then maybe you're actually into Zumba and you implement Zumba into your routine. You're like, okay, this is fun for me. I'm actually loving it for my routine and it works for you. So sometimes we have to experiment on what we enjoy and what works for us. So our overall goal of implementation is we want to focus on building something that's flexible, something that we can adjust on the hard days and still keep moving forward. So through cancer diagnosis and into survivorship, a lot of it is like up and downs, right? We hit peaks and valleys. Maybe we exercise for a couple of weeks. We're feeling good. We have this routine. Then week 3 comes along. I mean, we had a lot of appointments. We traveled for work. We kind of go off the exercise track. We want to have a flexible schedule and something that works for us. That it's okay if we take a couple of days off, but how do we find a way back up to that exercise and kind of get back on track with that? So we're going to kind of break down barriers to exercise. So we're going to go over 3 main barriers to exercise today. The first one is time. So where can I find time during my busy week to exercise? This is the number one barrier to exercise, no matter who you end up talking to, kind of overall of every poll that's ever been done in research, is time is the biggest barrier. So we're going to talk about that today. The second one is side effects. So I'm experiencing all these side effects and I don't know how to manage them during exercise. So we're going to break down some tools that you can utilize in your everyday exercise and lives to kind of help manage those side effects and kind of be really keyed into how you're feeling. The third one is there's a lot of unknowns when we talk about exercise, right? So maybe you've been to your oncologist or doctor and you get to the end of your appointment and when you're going out the door, they say, hey, by the way, you should start exercising. But you have no idea how much, what kind, even to start, right? Exercise is very broad. So how do we know how to break it down and actually make it worthwhile and make it into our routine? So first, we're going to tackle this time barrier. So first and foremost, to think about our calendar. We have to schedule in exercise. We have to make exercise a priority in each of our calendars because life is so busy, right? If we don't make it a priority, it will not happen. So a couple options or kind of ideas of adding it to your calendar is say you sit on a Sunday night and you're looking at your week overview, whether you're a paper planner person or in your computer or phone, and right, you put work requirements in there, maybe school, different things, right? They're written in your calendar. You also got to put exercise in there so you're not scheduling over that time you've planned. Number 2 is booking an exercise class. So maybe you need that accountability piece in your exercise routine. So maybe there's a rec center or senior center in your area that offers exercise classes. Book the class, right? Book it in a week advance, kind of put it on your calendar. The odds are that we are someone's expecting us to show up, our odds are we're going to show up more because we're accountable to that class or person. Even if you pay for a class, like you're like, okay, now I'm putting my money towards it, right? I'm more encouraged, or that accountability piece. The third one is plan social activities that involve being active. Sometimes in our current world of all the things, sometimes a lot of activities revolve around, restaurants or different outings where it's food are involved or anything like that. So make it a priority for yourself to plan activities that involve being active. So a couple of examples of this might be, maybe you have a neighbor or you in your neighborhood, and you're like, oh, I should catch up with them. Say, let's go on a walk around our neighborhood and catch up rather than like maybe sitting in the backyard. Or another one I like to use or give people is, you have a phone call, maybe you have a parent or grandparent like, oh, I should catch up. Take it on a kind of a catch up walk. So take a walk around your neighborhood and catch up via phone as you're walking. Maybe you're into pickleball or different sports or things you want to try, is like make those social activities in your calendar also active to kind of add in that physical activity. And the fourth one is, sometimes it works for people, sometimes again it doesn't. But that motivation piece of using stickers to mark when you exercise. I've had a lot of people who have kind of a calendar on their wall and they add a sticker when they exercise that day. And so once you kind of see 3 stickers in a row, you're more likely to exercise that fourth day because you don't want to not put a sticker on your calendar, right? So sometimes that works for people, and kind of that mind game of like, okay, I need that extra motivation to work out today. The second piece is start small. Again, we don't have to start training for a marathon next week. We can break it up into manageable pieces. So here's a few ways we can just add a little bit more exercise into our everyday, even if we're not going to the gym an hour a day. The first one is take the stairs if it's available. If you're in an airport or a shopping mall, or you can, and there's an option, take the stairs. I promise those small things will add up. Two is park farther away at the store. I know maybe your family might argue with you at first, but they'll thank you later if you park, again, even a few spots away from the store. Get a few extra steps in before you get into that store. Number three is do body weight movements during commercials. I know a lot of us kind of tend to grab our phones and kind of start using those. Get up during a commercial, do 10 squats, 10 counter push-ups, and a few calf raises. Kind of get something into that movement. Then we can still enjoy our shows we all love in the evening. We were getting a little bit of movement in addition to those. And the fourth one is huge now that we're all on screens all the time, we're working all day, is stretch between meetings, whether that is a Garmin or Fitbit that reminds you to get up and get active. Again, just a stretch, kind of bend over, do a few squats, get that blood moving to really help avoid that inactivity or sedentary time within our day. Okay, so we're going to kind of go back a little bit to where we talked about those exercise guidelines when I said that the goal to get those health-related outcome benefits is 150 minutes of aerobic exercise per week. When we look at it as a whole, we might think that's a lot of minutes, right, per week. So we're going to go over a few ways that we can break that down to make it manageable. The first one is 150 minutes a week is actually 30 minutes a day, 5 days a week. So you can take 2 rest days, but if you exercise for 30 minutes, 5 days a week, you'll get that 150 minutes in. Another way is, maybe I don't have 30 minutes to dedicate, do 15 minutes twice a day. Maybe I go on a walk in the morning, 15 minutes with my dog, and then I lift some weights for 15 minutes after work. So you can break it up. It does not have to be a continuous 30 minutes. And even more so, if you break it up, that's 10 minutes 3 times a day. So I put this little apple here because in research in the exercise ecology world, we call these exercise snacks. So maybe you don't want a full meal or a full hour of exercise, but you have time for a couple snacks, right? So you have a couple 10-minute breaks within your day. So maybe that's in the morning between a couple meetings, at lunch you go on a quick walk, and in the evening. So that all that time adds up. We don't have to do huge chunks of exercise for a super long time to see that benefit. Goal really is just to add a little more activity in our days. Okay, 2, or our second main barrier, is the side effects. So a big thing we're going to talk about here is self-monitoring. So big kind of learning about how to check in with ourselves during exercise. So really being keen on how we're feeling that day. And as I said before, we can all feel different every day. So we always have to check in with ourselves when we're thinking about exercise. The first way we can use self-monitoring, we kind of went over in the beginning, is using exercise intensity. So that talk test, rate of perceived exertion, or heart rate. I didn't talk about heart rate today because sometimes that can be variable based on medications that we're utilizing, or excuse me, we're taking during treatment. So I prefer the talk test and RPE just so we can monitor ourselves without that self-subjective sense of monitoring. 2 is side effects. So how I'm actually feeling today, which we're going to get into. And then we're also going to talk about an exercise level system, or a stoplight system. Talk about what type of exercises will work for me today. So the first thing is, is learning how to exercise based on how you were doing that day. So in my program of Project Rex, every participant follows this pre-session check-in. So no matter how long you've been going with me, before you start the session, we're going to fill out a few questions. This is A, for me as the trainer to gauge how you're feeling that day to make kind of accommodations or scaling options, but then it's also for you or whoever's filling this out to kind of take a second and kind of reflect on how are you feeling this day. But you can integrate these questions into your daily routine as well. So the first one talks about please indicate your fatigue level at the current moment. So I know a lot of us think about maybe the past week or the past month, how fatigued was I? But I want you to all think about like even in this exact moment, how fatigued are we feeling? Are we feeling extremely fatigued? Are we full of energy and ready to move? And kind of gauging that on a 0 to 10 scale. That second one is indicating how you're physically feeling today. Are you exhausted? Are your muscles sore? Like how are you feeling overall physically today? Are you ready to go or totally depleted? The third one is emotionally how you feel. This is a huge factor I sometimes we take out of exercise because it's like, oh, I'm just physically moving my body. But the emotional or mental aspect is also super important and can affect all of our exercise sessions. And then the fourth one, I think sometimes we overlook as well, is indicating how well you slept that night. So, did you sleep excellent? Were you completely restless all night and you didn't get really full hours of sleep? Because that can affect what exercise you do, how much energy you have the next day, and really everything you do that day, right? So, these are just a couple options of ways you can check in with yourself. And I'm going to show you in a second how we're going to integrate this into exercise. But again, these are simple. You don't need any major tools or technology to do this. You can even keep a journal of yourself of like, okay, I'm getting ready to exercise. I'm just going to check in with myself. And then I also ask these same questions immediately after the exercise session. So we use it as like a tool. Someone maybe comes in with low energy that day, they have high fatigue, and they rate their fatigue at a 9 before the session. They exercise for 60 minutes and they fill back out this and they're like, oh, actually, I'm a 4 now. I feel way better. I feel energized from exercise. It's a way to kind of check in with yourself. Did this exercise session make me feel better? Did it not? Some days we have where fatigue gets worse during exercise, and that's okay. But now we know maybe I pushed it a little bit too hard in the session, and tomorrow's session, I'm going to kind of reel it back in, change the exercise intensity, and make it work for me today. Okay. So this is what I'm talking about when we talk about this kind of stoplight or this energy level system. This kind of model was kind of adapted from different behavior change models and clinical settings. But what it means is, again, there's a green light, an orange light, and a red light on this light. So as I can see, there's that 0 to 10 scale in the middle. Red, so we're thinking about red light that day. So you would have to kind of put yourself in a category based on how you're feeling that day. So what is your health status currently like? Are we experiencing any symptoms or mild symptoms, or are they kind of extreme symptoms of nausea or pain? The other thing I was thinking about is our blood count. So that might be very applicable to people going through treatment. So here's how you can help gauge what maybe exercise you do that day based off how you're feeling. So I'm going to show you this. So these are the 4 same movements. So the 4 same movements are in green, orange, and red, but there's different variations or scalable options of all 4 of these movements based on what stoplight color you picked to do that day. So for example, say I came in tomorrow and I'm going to go exercise and I look at this same, I'm like, okay, I'm feeling pretty good. I'm not really having any major symptoms right now. So I feel like I'm a green, right? So I'm going to go over to my green and look at, okay, I think I can do a weighted squat that day. Where maybe Sally comes in and she rates herself an orange on the scale. She's still going to do squats, but maybe she does an air squat today instead of a weighted squat because she has some mild symptoms, a little bit mild pain. So that's where she would adjust versus Jerry, who comes in and he rates himself a red on the scale. He has maybe lower health sum, he's having some symptoms or side effects. He will still do his squats, but he's going to do sit to stands today. So similar thing across. So we have say weighted barbell push press, dumbbell push press, or PVC pipe. So we can adjust. So we can still do the movement, but it's just a different option for us that day. The last one I want you to look at is aerobic wise. We can do this too. So maybe you're in the red that day. So you're going to hop on a stationary bike and do just some steady state stationary bike. Maybe you're feeling pretty good. On orange, you do some walk to elliptical versus green. Maybe that's a day you're jogging or hiking. So I want you all to kind of think about this and how maybe you may be incorporating this into your daily activities or daily routine on how to help you pick movements. Because what I like to think about is even when we're not maybe feeling our best that day, we can still benefit from some movement. So I don't want you to think about, oh, I can't do any movement today because I'm in the red. Maybe we're just adapting the movements we're doing. So we're still getting benefit from exercise. We're just not doing weighted squats today because that's not where our energy level is or health status that day. So it allows us to kind of adapt day to day based on how we're individually feeling. Now we're talking about our third one, or this unknown. So again, we have our workout log here. We're like, okay, but what do I fill in, right? How do I know what workout type, duration, intensity to do for all of our days? We're going to go through three different options, or these are all examples. Again, these are not all encompassing. These are just three that I picked that we can talk about today. Mainly, it's making a plan for you to leave here. So we're going to talk about circuit training, interval training, and outside workouts. So the first one is our circuit training. So I'm going to give you two examples of what circuit training really is and different things you can incorporate into your daily routine. So example one, so circuit training could be 3 rounds of movement. So you could do 12 squats, 10 push-ups, and 30 jumping jacks. So how this could work is your circuit is, one circuit is 12, 10, and 30 of those movements, but each one is kind of a different area. So it's kind of like stations. So you'll do 12 squats, then you go to another station, do 10 push-ups, and then another station do 30 jumping jacks, and you'll repeat that 3 times. That's an awesome way to get some movement in with some different activities and kind of do that circuit training. The second one is doing an AMRAP. So AMRAP stands for as many reps as possible. So you'll put a clock on your wall or your phone and you'll just run it for 12 minutes. You're going to do 8 bird dogs, 8 glute bridges, and 8 dumbbell push press. You're going to go through as many times as you can over and over until you hit that 12 minutes. So this is a great way to kind of take the pressure off yourself of it doesn't matter how many rounds you get. The goal is you're just going to move for 12 minutes, and as many rounds as you get, that's as many as you're going to do that day. The next one we're going to talk about is interval training. So we can make these high intensity, we can make these low intensity, a couple different options. The first one we're going to talk about is a Tabata workout. So if you've never heard about Tabata, it's a style of workout that you work for 20 seconds of higher intensity exercise, and then you rest or recover for 10 seconds. You alternate between working for 20 seconds and resting for 10. So for example, workout could be, you could do 20 seconds on of lunges and then 10 seconds off. 20 seconds on of object overhead. So you pick an object, touch the floor, bring it all the way overhead. Then you're going to do that same thing for marching. So marching in place and then bent over rows. So really it doesn't matter what movements you pick, but the goal is you're trying to get that heart rate up for 20 seconds and then letting it recover for 10 and repeating that again. The second option here is called an EMOM, so every minute on the minute. So this means at the start of every new minute, you're going to start a new movement. So for example, a 15-minute workout would look like minute one, you do 10 ring rows. Minute two, you'll do 10 kettlebell swings. And minute three, you're going to do 50-meter jog or walk. So what that means, so minute one, you're going to do 10 ring rows. And when you're finished with that, you get to rest the remainder of your minute until minute two starts. So in 15 minutes, you get 5 rounds of this workout done. So again, that can allow you to go on your own pace and kind of control for that intensity level that feels today. Then a couple options. So outside workouts, I just mean is like outside in your own environment. So maybe you're like, oh, I don't have a gym membership. I don't have a ton of equipment at home. We can still think of ways to get active and get outside and keep moving. So the first one, is called around the block. So say you just walk out right outside your front door, wherever you are today, and you pick kind of just a general section where it's a block around your neighborhood. What you're going to do is you're going to have essentially 4 corners that you're going to designate on your block. You're going to walk or jog between your corners. And when you get to every different corner, you're going to do movement. So I'm going to walk or jog to my first corner. I'm going to do 20 squats. Walk or jog to my second one, standing crunches. Third one, sidewalk step up. So kind of just feeling our area of our street. And then corner 4, maybe you have a park bench or something near and you're going to do some bench push-ups. So this is kind of utilizing our environment, our neighborhood to get outside and work out. Another example is a park bench. So maybe you have a park next to. We're very fortunate in Colorado here where I'm located. We have a ton of outside areas, right? So I go find a park bench. I could do 4 rounds of 10 bench burpees, 12 sit to stands on that bench, and then 14 calf raises. So I'm utilizing the equipment that I have around me to do resistance training and that aerobic training without having to have any kind of major equipment or gym space to do this. Okay, so kind of as we wrap up here, I wanted to share a few quotes that participants from my program have shared and kind of what we've gotten through and kind of taught in our program. So the question I asked them was, exercise is teaching me ... And here are a few responses I got. Exercise is teaching me I'm allowed to be strong. Exercise is teaching me how to love whatever my body can do right now. Exercise is teaching me that I'm stronger than I think. Exercise is teaching me I can feel better and I am in control of this piece of my health. And finally, my last question I asked someone was, to someone just starting, so just starting your exercise routine, I would say dot, dot, dot. Show up for yourself, whatever that looks like today. So, if anything you took from my presentation, I really want us to think about the fact of you're allowed to prioritize yourself and have kind of show up for yourself on these days and exercise and get those benefits from yourself, no matter what that might look like. Just prioritizing movement and exercise, whether that's walks, lifting weights in the gym, working out with friends or family, but prioritizing yourself for whatever that looks like today. And no matter way you can, just show up for yourself. So that is all I have today. I thank you all again for your attention. We'll kind of go to questions now and everything, but it was awesome to speak to you all. I'm going to go ahead and stop sharing. I will say, Christine will share in the bottom, but my contact or info is here on this screen. So my email is that top one, so Emma at projectrxco.com, or my website, if you want to check out our programs, is www.projectrxco.com. We're on Instagram, we're on Facebook, so check us out. We provide group and personal training classes in person and virtually across the country for individuals who's interested. So please, again, I'll answer as many questions as we can with the time we have left. But if you have additional ones, please reach out and contact me. I'd love to chat with you one-on-one and kind of help you get moving in your own individual situation. But I'll stop sharing my screen for right now so I can answer some of your questions. But thank you all for your time.
Thank you so much, Emma. That was such a great presentation. And for everyone, I recommend taking a quick, it was
Oh,
the same.
do you want me to reshare it real quick?
Maybe just like if you haven't
Yeah,
taken a
yeah, of course.
screenshot, do so.
Yeah,
I put
of
Emma's
course. I'll do
email
that.
in the chat before we take that down. A recording of this will be shared after, but we won't be sharing the slides, but you'll be able to go reference any of this material in the recording. And so now we can jump into questions. So if you have one, drop it in the chat and I can call out the questions as they come in. Emma, we do have one from Tim.
Okay.
His question is that his wife is currently in chemo and the oncologist only recommends walking as an exercise. She would like to do more. Any suggestions or any exercises that help with neuropathy?
Yeah. So most likely, again, sometimes this is very individual based. I would say the first thing you can do is have a conversation with that oncologist and say why it's particularly only walking. Is that because of certain medical reason or whatnot? So first, I would for sure check in with your oncologist before you move forward that way. But sometimes we think about walking as low intensity exercise. So that doesn't mean we can't do some resistance exercise. So any kind of exercises in chairs or something that gets that heart rate lower would be a good option in looking at chair exercises or things like that. But first and foremost, check in with your oncologist and make sure there isn't a very specific reason that you can only walk. But if you are medically cleared to do more, I would say the step up from walking would be any kind of low impact chair exercises. So, kind of sitting, any kind of arm or lifting in a chair would be a great first step. And just if we can add in some weights to that, would be my main priority for all of you. Yeah.
Awesome. Thank you.
Mhm.
Anyone else have any questions that they want to drop in the chat? Dean is asking if you have any opinions on vibration boards.
Yeah, so I think at the current time, there isn't enough evidence in oncology, specifically in the exercise oncology world, to support any kind of evidence of pro or con. So I would say we might have to wait to find out. But I will say if we can ever prioritize that functional movement of actual weight training would be preferred, but I just don't think we have enough information at the current time where we are in research of they're just gaining popularity. We just don't have enough information to kind of make infinitive decisions or statements right now on that. Yeah.
Pat is curious. They do 10 minutes on the treadmill, 10 minutes rowing, and 40 minutes of strength training twice per week. And then they walk for a half an hour 4 times a week. Does that equate to the 150 minutes aerobic?
Yeah, so it sounds kind of like oh see, let me make sure that I can read that so I can calculate. So it depends what intensity you're doing on that treadmill and rowing. So as I said in my presentation, if we do intense or vigorous exercise, we need less minutes to see those health benefits. So if we're increasing that intensity, that sounds like you would even hit it doing moderate to light activity. It seems like you're doing an awesome job kind of prioritizing strength base and that aerobic. So I think you're on a right track, and I would just keep up exactly what you're doing. Yeah.
Awesome. Thank you. And then Kathy is curious, yeah, what intensity a rowing machine would be.
Yeah, so again, this would be individualized. So the best way you can do this is I'd hop on that rower and try to have a conversation. So no, say I'm rowing on my pace, can you have easily have a conversation? That's probably light intensity on that rower. Are you able to kind of have some words, but you're not having full sentences? That would be that moderate intensity on that rower. And if you're kind of like out of breath, like you're not able to kind of make full sentences, that means you're probably working out a vigorous intensity on that rower. But again, it's hard to tell. There's not one intensity on the rower because someone could be pulling a little bit harder than another, and that would make it two different intensities.
Great, thank you. And Darlene is curious if there's a way to increase bone density.
Yeah, so we have to be incorporating strength-based exercises that put that external load on our bones. So walking is awesome for cardiovascular, but it's not going to necessarily help with that bone strengthening. We have to start lifting weights, using machines, things that put loads on our bones. So squats, push-ups, lunges, those kind of body weight movements, if we don't have any weights, are the best thing we can do is we've got to start adding weight-based exercises into our routine to gain that bone density.
Great, thank you. And then Dean
Mhm.
is asking if you can go over the 150-minute thing again. He's asking about 150 moderate plus resistance twice a week, or just clarity on that.
Of course, yeah, I'd love to. So, this is again 150 minutes. Don't get too stuck on that exact guideline. This is just what research currently shows that we have enough evidence to prove that at least 150 minutes is beneficial for those health-related outcomes. But what that means is, yes, it is 150 minutes of aerobic moderate exercise, so that walking, jogging, biking, plus the 2 days of resistance. So the best thing you can do is do that 150 minutes of aerobic exercise plus the 2 days a week of resistance. And if you're doing any of the circuits, like I showed you, that has a combination of aerobic and resistance, those can work together. You don't have to do them on separate days. You can add them together and do them on the same day.
Great, thank you.
Mhm.
We're just about out of time. Thank you everyone for joining. And Emma, thank you so much for sharing all of
Thank
your
you.
wisdom on such a, important topic. It's movement is something everyone has access to, and the evidence is just so strong. So thank you for helping to kind of clarify how people can engage with movement in a new way. So
Cool.
yeah, thank you so much. And yeah, be sure to subscribe to our newsletter if you want to be in touch on future webinars. We have ones on financial toxicity and also kind of questions to ask as you go into survivorship coming up. So thank you all for joining and supporting Cancer Choices. And we hope to see you all again.
Thank
Thank
you all for your
you.
time today.
Yes. Bye.